Radiation oncology has changed a lot since I first started training. The treatments have become more precise, and so that's meant better chance to control tumours and cure cancers, but also that's improved the lives of people in terms of less side effects and less long-term consequences from the treatments.
We have spent the last 20 years or longer collecting big data sets, including genomics data sets, the patient-linked data sets. There's so much data now available that it's become a research sort of industry now to mine that data.
The access to patient specimens for us has been the most important part of the evolution of the disease, where patient specimens from the trial come back to the lab and they get reanalysed, and you can then say, okay, patients that showed some response to the drug have this landscape, whereas patients that are completely resistant have this, and then we can start to reverse engineer how we might do the next clinical trials.
I would say the most significant advance in cancer research in the last 20 years is the rediscovery of the immune system as a way to control cancer.
Immunotherapy has really revolutionised even breast cancer outcomes. We're seeing women, 95% survival rates at 5 years for women with breast cancer, and this is because the therapies are changing, but they're also being introduced earlier in the patient journey.
Having gone from 2005, when we had so few options for so many patients, to seeing perhaps 70–80% of patients today with incurable disease, we can find through genomic profiling options for treatment that we would never have suspected otherwise.
And I think that that's the power of being able to have that clinical community and that infrastructure in place, that we can really translate the work that we're doing quite rapidly into patients and into that clinical setting.
And it's working together with the tools we have, the public health initiatives we have to improve cancer care that has really made the difference since 2005.